Hello, my name is Anna Rembecki, and my in-service presentation is on physical therapy in the emergency department and why it can be used to decrease the need for opioids for patients with low back pain when they present to the emergency department. So why are we talking about this? What is the big connection here? Low back pain and opioid prescription in the ED are actually very connected. Most people don't know this, but back pain and back-related complaints is actually one of the top 5 reasons that people will present to the ED between the ages of 18 to 84 and then get subsequently discharged. So most people will come in with an issue that, might be a fall or might be a chronic back pain issue. And they will come to the emergency department because they don't know how to manage this pain. It's something that they just cannot control, and so they go to the emergency department to see what they can do. So obviously this is a big issue, and it is actually the most common diagnosis for which opioids and benzodiazepines are co-prescribed in the ED. So there, presents not a clear way for people to manage these pain symptoms that doesn't rely on the prescription of opioids at this point. So this is something that is very important for us to try to combat, especially with this opioid epidemic in the United States. This is something very common though. So 30% of low back pain patients that present to the ED actually get prescribed opioids. So not only do people come in looking for this, it actually does get prescribed on 30% of occasions, which seems like a strikingly high number for the amount of caution with opioids these days. And 36% of these patients that do get prescribed opioids report still taking these opioids 4 weeks past their emergency department visit. So obviously this shows that there is a dependency with these opioids to treat this pain. And this is an issue that physical therapists should care about, and I will tell you why. Physical therapists should care about this issue because physical therapy can actually be used as an alternative to prescribing opioids for low back pain in the emergency department. So across the nation, physical therapists are actually being implemented as a growing resource for patients to, get some treatment right on the spot. A lot of patients present to the emergency department with issues that are typically seen in the outpatient setting. So a patient might come in with an injury, they might have just had a fall, they may have come in with neurologic pain, musculoskeletal pain, issues you typically treat in the outpatient setting, but physical therapists can actually treat these issues right in the emergency department. So that is very cool. One of the big issues, big injuries, impairments that physical therapists actually treat in the emergency department is low back pain. So typically this is used as a triage method, as a way to improve patient-centered care, but physicians are actually turning towards physical therapy as an alternative to prescribing opioids in the emergency department. Physical therapists, can manage low back pain and lessen it. So physicians see that, and they're actually utilizing this resource as a way to mitigate the prescription of opioids, which is very cool. So with treatment of low back pain, patients actually report lower pain values after their physical therapy intervention, and patients in the outpatient setting actually, say that they use less opioids. There's a lot of studies and claims that point towards patients, utilizing opioids less in the outpatient setting when they are receiving that physical therapy. So the big difference here is, giving a man a fish and teaching a man how to fish. It's the same issue. So you can, give a patient opioids as a way to reduce their symptoms, or you can teach them how to reduce their symptoms and give them that functional independence back. And so these issues not only, can improve a patient's quality of life, but actually give them confidence in, their ability to move and manage their pain. So this is very cool. So what is the clinical application to this? How can physical therapists utilize, their resources to help patients? Well, I am presenting a protocol that physical therapists can actually give their patients in the emergency department and also as a home exercise program to, treat this low back pain in the emergency department. So a lot of this research comes from the clinical practice guideline for low back pain interventions from the 2021 revised edition. One of the main things that the clinical practice guideline protocol did support is that centralization exercises for reducing symptoms of low back pain are actually strongly recommended. So typically people think of these, as McKinsey method exercises. basically centralization is a great thing that physical therapists will see in a patient because it means that the exercise is working. So if a patient has, back pain symptoms, but, these symptoms are referred to other parts of their body, if they are given some intervention and they see these, symptoms kind of centralized to the back region, this is a sign that this exercise intervention is actually working in their patient. So we would like to utilize this, method, and here's a couple ways we can do that. So one of the ways that is really common for patients is prone lying, to prop up, to press ups. Typically patients that present with low back pain may not have the mobility in their low back to do the full press up because they don't have that lumbar extension. But this is a way, to introduce this kind of technique to a patient. So a patient can start, with lying prone, and then they can prop up to their elbows, get that initial lumbar extension, get those rector spinae muscles moving. This typically is seen to, treat low back pain. So patients can do this multiple times a day. They can hold this for 30 seconds. The next thing they can do is a lumbar flexion exercise. So a patient can lie on their back and bring their knees to their chest, typically kind of like a fetal position. But this is another way that patients can, stretch their back, centralize those symptoms, and they can do this multiple times a day. Hold that for 30 seconds. If a patient is able to get in the quadruped position, another great way that symptoms can be centralized in low back pain patients is doing cat-cows. So cat-cows, you will alternate between that lumbar flexion and extension, and typically we can do 10 of each. So 10 lumbar flexion, 10 lumbar extensions. Very slow, controlled way, and we can do this multiple times a day as well. These are ways that we can show patients how to stretch their back in safe and comfortable ways that can promote a reduction of these symptoms. So this is centralization. We will get into strengthening and coordination exercises. Moving on, another thing that is coming from that clinical practice guidelines says that trunk coordination and strengthening exercises to reduce low back pain symptoms are also recommended. So, after we move on from those initial, slow stretching kind of movements to centralize those symptoms, we can progress towards coordination and strengthening exercises. So one of the big ones we typically see is doing bridges, and if a patient has never done this before, this is a great motion to introduce and maybe progress over time to be able to do this. So educating a patient on this is really important. Bridges are good for your glute max, also your rector spinae, your quadratus lumborum, all of these, low back area muscles. This is a great exercise for. So it just promotes, that strength in the low back. This is something we can do multiple times a day. Again, we can do 10 sets of each. And then we can progress to Supermans for patients comfortable in that prone position. This is something they don't have to get, too far off the ground, but promoting that static hold of, lumbar extension is really going to strengthen those muscles and promote some, reduction of symptoms. So this is something they can do multiple times a day. Again, they can hold for 30 seconds if able to. And again, if they have never done this before, this is something we can introduce in the ED and give them as a home exercise program. So those are important. And then again, the last one, if they can get in quadruped position, something great is bird dogs. This, not only strengthens rector spinae, but also multifidus, and also promotes just coordination in general. So it's good for the back and core. If they can get into this position, it is great for all of these things. And they can do this again multiple times a day, a set of 10. All of these exercises, like I said before, can be given as a home exercise program if a patient feels comfortable doing these things. And then, after that, they can be outsourced to physical therapy in the outpatient setting. To conclude, here are my references. I hope that physical therapy can be used in the future to reduce the prescription of opioids, and the protocol, can be given to patients to promote that independence in managing their back pain symptoms. So there is actually research being done on this at University Hospital in Columbia, which is very cool, a little bit close to home. So that kind of gives us hope for the future in our local community. So thank you so much for listening.